Hello, my name is Vera Kimbrell. I'm the 2017 chair of the SMRT Safety Committee. The SMRT is an international organization with an educational mission and focus. The Safety Committee is the arm that produces MRI safety education, interacts with vendors, and advocates for MRI safety in the international community. The committee has produced this Level 1 video to address basic MRI safety education. We hope you find it useful in training staff at your site. I'd now like to introduce John Posh from the USA and Claire Mulcahy from Australia, members of the SMRT Safety Committee, who will now provide the audio for our presentation.
Welcome to our Level 1 MRI Safety presentation. This is a basic MRI safety presentation for all staff in the MRI environment. We'd like to start by emphasising that this program has been prepared to provide education that promotes safety in the MRI environment. It's important to note that the content of this presentation does not replace any industry regulations or site-specific policies and procedures. The aim of this presentation is to provide a basic overview of key aspects of MRI safety. We'll first provide a brief description of MRI and the MRI environment, then highlight MRI safety risks, and go on to provide information about key steps required to promote safety in the MRI environment. At the end of this presentation, all staff accessing the MRI department will be able to describe the MRI system and the MRI environment, describe key MRI safety issues, understand the importance of MRI safety screening, and describe the MRI safety screening process. Finally, all staff will have an understanding of emergency situations that could potentially arise in the MRI environment. So, what is MRI? MRI stands for Magnetic Resonance Imaging. It is a unique imaging modality that uses a strong magnet and radio frequency magnetic fields to produce detailed images of the human body. It does not involve ionizing radiation, such as X-rays, and there are no known side effects of having an MRI examination if safe practices are followed. The MRI system. MRI systems are operated by specialist staff trained to use this equipment. Each MRI scanner is housed in a dedicated space inside a shielded room. The computers we use to view the images are located outside the scanner room in the MRI control area. Because of safety concerns, there are restrictions that apply before using equipment in the MRI area. All equipment and accessories must be approved for use in the MRI scanner room. There are actually 3 magnetic fields used to generate images in MRI. These include the static magnetic field, the radio frequency, also known as RF magnetic field, and the gradient magnetic field. We will now discuss each of these magnetic fields in more detail. The static magnetic field is produced by a large and powerful magnet. Different systems use different types of magnets to generate the static magnetic field. Examples of different magnets include permanent magnets, resistive magnets, and superconducting magnets. Superconducting magnets are the most commonly used magnets for clinical MRI systems. The majority of 1.5 Tesla to 7 Tesla MRI scanners are superconductive systems. They require a power supply and cryogens, such as helium, to maintain the static magnetic field. It's important to know what kind of magnet you have in your institution, as each type has different requirements for maintaining the field and may or may not require cryogens. It's also important to know if the magnetic field of your magnet can be switched off, as this may be required in emergency situations. Turning the magnetic field off is not a trivial matter. We will discuss this further later in this presentation. The strength of a magnetic field is measured in Tesla or Gauss, where 1 Tesla is equivalent to 10,000 Gauss. Most MRI systems are described by the strength of the static magnetic field in Tesla. MRI scanners in your institution may be referred to as a 1.5T or 3T scanner. Any spatial gradient or change in a magnetic field with distance is measured in Tesla per meter or Gauss per centimeter, as the value varies with distance. The maximum field strength and maximum spatial gradient of the static magnetic field are two important specifications that you should know about your MRI system. They will be needed to help establish whether an implant, device, or piece of equipment is safe to enter your specific MRI environment. The second magnetic field used in MRI is the radiofrequency magnetic field, or often referred to as the RF magnetic field. Radiofrequency pulses are used to create the MRI signal. RF energy is transmitted from the transmit RF coil inside the MRI scanner to the patient. Then, the receive coil, which is positioned around the patient's body in the area being imaged, is used to detect the signal. This picture is an example of a receive coil for imaging the knee. The third magnetic field used in MRI is the gradient magnetic field. Gradient coils of the MR system produce gradient magnetic fields that spatially vary in strength across the patient to help localize the signal for image formation. There are 3 sets of gradient coils, one for each direction. Gradient magnetic fields effectively provide coordinates for signal received from each point in the imaging volume. The slew rate is a measure of how quickly the gradient system can be ramped on or off, and is expressed as Tesla per meter per second. John will now talk to you about the MRI environment.
Thank you, Claire. MRI departments are similarly designed to restrict access to the strong static magnetic field. This is to prevent untrained, unscreened personnel or members of the public from inadvertently entering the MRI scanner room and coming into contact with the strong static magnetic field. There are a number of guidelines around the world for restricting access in MRI departments, but all these guidelines have the same objective, which is to ensure safety in the MRI environment at all times. One approach widely adopted to restrict access to the static magnetic field of the MRI scanner is the 4-zone design recommended by the American College of Radiologists. In this design, Zone 1, for example, is the lobby or reception area, which allows general public access with no specific restrictions. Zone 2 for example, the changing rooms and screening areas, is not general public access. Zone 3, the MRI control or console area, is restricted access where persons must be screened and/or supervised by trained MRI personnel. Zone 4, the MRI scanner room, contains the MRI system and is also restricted access where persons must be screened and supervised at all times by trained MR personnel. Here is an example of an MRI suite where Zone 1 is the reception area and entry to the MRI suite. Zone 2 encompasses the changing and patient screening areas. Zone 3 contains the MRI control area and entry into Zone 4. And Zone 4 is the MRI scan room itself. This departmental design reduces the chances of individuals accidentally entering the MRI scanner room because persons must pass through the supervised and restricted zones before coming in contact with the static magnetic field of the MRI scanner. An important aspect of the static magnetic field that you need to be aware of is the fringe field. The fringe field describes the strength of the static magnetic field away from the center of the magnet. The strength of the fringe field is often considered when determining MRI safety of implants, devices, and equipment in the MRI environment. It's important to note that the fringe field decreases with increasing distance from the center of the magnet in all three dimensions. The fringe field is measured in Tesla per meter or Gauss per centimeter because the strength of the field varies with distance. In your department, you need to be aware of the 5 Gauss line of your MRI system's fringe field. The 5 Gauss line is the point in the fringe field where it is generally considered unsafe for non-MRI safety screened individuals to pass. The physical location of the 5 Gauss line varies between scanners and is dependent on the scanner's field strength and system design. Most often it's contained within the MRI scan room itself, but at some sites it may not be contained within Zone 4, so it's important you know where the fringe field extends to in your department. So now that we understand the MRI environment, let's talk about why we restrict access and explore some of the risks encountered in MRI. If not treated with respect, the MRI room can be a dangerous place for both staff and patients. The projectile or missile effect is the safety risk of the static magnetic field and describes the greatest potential for injury to all in MRI. The static magnetic field of the MRI scanner is very strong and always on, even when the scanner is not in operation. The static magnetic field of a 3 Tesla magnet, for example, is approximately 60,000 times stronger than the Earth's magnetic field. Translational or attractive forces act on metallic objects when they experience the static field. The speed and force of ferrous objects attracted to the scanner bore is dependent on their composition, size, shape, and position in the fringe field. Accidents involving metallic projectiles have caused injury and even death in MRI. Accidents happen in MRI when ferromagnetic objects are brought into the scanner room. Ferrous metallic objects are drawn to the magnet bore with great force and can easily be pulled out of hands or pockets. A paperclip, for example, can travel up to 40 miles per hour, equivalent to 64 kilometers per hour, towards the scanner in a 1.5 Tesla environment. Accidents involving small or large objects such as these can damage equipment and injure people. Here are just a few examples of large objects being easily drawn into the MRI scanner. Such accidents are often a result of improper supervision of non-MRI safety trained individuals or improper training of staff working in the MRI environment. Unfortunately, sometimes these accidents can be fatal. This was the case when a 6-year-old boy, Michael Colombini, was hit by an oxygen cylinder with a magnetizable casing during an MRI examination. Michael was having a routine scan under sedation, and before the exam began, the anesthesiologist observed a decline in his oxygen saturation levels. The MRI technologist was attending to some problems with the oxygen supply from the wall outlet when a ward nurse passing through the department heard the anesthesiologist's cry for help and handed him a portable oxygen cylinder near the door of the scanner room. The anesthesiologist turned to approach the boy with the oxygen tank when the magnetic attractive force pulled the oxygen tank from the doctor's grasp. The tank was drawn with great force to the center of the scanner where it struck Michael in the head, causing fatal injuries. Safety risks also exist within the radiofrequency magnetic field. When conductive materials are placed within the radiofrequency field, a concentration of electrical currents can cause excessive heating, which can result in tissue damage. Even under normal scanning conditions, some patients may feel warm. Tissue burns are the most often reported MRI adverse accident. Here is an example of an MRI radiofrequency thermal burn where amputation was required. This 5-week-old girl received 4th-degree burns when a pulse monitor was used during her scan that was not safe for use in the MRI scanner room. A current was induced in the loop of wire around the girl's wrist, and that heat energy was concentrated at her wrist during the 40-minute MRI scan. This is another important reference example of a radiofrequency burn in MRI. This person was questioned prior to MRI as to whether he had any devices or implants inside of him. He had, in the past, had an implanted deep brain stimulator, but the generator box had since been removed. As far as the patient was concerned, the whole system had been removed, so he answered no to having such a device in situ and went on to MRI. Unfortunately, the transmitting leads were still inside of him, and for the duration of his scan, the leads were within the radiofrequency field. During the scan, heat energy was transmitted along the length of the transmitting wires and resulted in radiofrequency burns in his brain. The MRI operators noticed he wasn't behaving the same as prior to his scan, and he was sent to head CT, which revealed the implanted wires and corresponding tissue damage adjacent to the tips of the wires. So from this example, we have learned that instead of asking a patient, do you have a device or implant inside of you, it's better to ask, have you ever had an implant or device inside of you? Such a simple turn of phrase can make a big difference in MRI safety screening. So to summarize, there are 2 main safety risks of metal in MRI that we need to be aware of. The projectile or missile effect, where ferrous metallic objects or implants are strongly drawn towards the magnet bore, and the potential heating of metallic objects or devices due to the exposure to the radiofrequency magnetic field. While non-ferrous metal objects and implants are not attracted to magnets, they are still a safety risk for heating when exposed to the radiofrequency magnetic field. The acoustic noise levels in MRI are considered a safety risk. Most people are familiar with the noise of the MRI scanner. The sounds while scanning are caused by the interactions between the static magnetic field and the gradient magnetic fields. The sounds vary between MRI sequences, and sound levels in MRI may routinely rise above 85 decibels. This is an important safety concern because prolonged exposure to such sound levels has been shown to cause hearing loss. MRI staff must prevent hearing damage caused by exposure to the acoustic noise of the MRI scanner. All persons remaining in the scanner room during scanning must be protected from hearing loss with appropriate hearing protection fitted correctly. Such hearing protection includes headphones, earmuffs, earplugs, or active noise cancellation systems. Remember to provide instructions for appropriate use and only use hearing protection with the proper rating. This graph of MRI sequences shows an example of noise levels in decibels recorded on a 3 Tesla MRI system. These are recordings of actual MRI pictures being taken. As you can see from the graph, all of the recordings were above 85 decibels, which is a concern for hearing loss. It's also important to note that sensitivity to noise varies between individuals and may be influenced by a person's age, health status, or even medications. Peripheral nerve stimulation is another risk of MRI resulting from time-varying fields such as the gradient magnetic field. It should be noted that peripheral nerve stimulation generally results in discomfort rather than long-term injury. Currents can be induced in a patient's peripheral nerve fibers, possibly causing sensations of pressure and/or pain, or may result in twitching sensations. This can be quite uncomfortable for the patient. The degree of sensation is dependent on the sensitivity of the patient, their positioning, and the types of images being acquired. As well as removing obvious metallic items from a patient prior to scanning, unrecognized safety risks include clothing containing metal-infused material or antimicrobial solutions, which often contain copper. These materials can heat and cause radiofrequency burns during MRI. Therefore, it is important that all patients should be changed into appropriate hospital clothes that are free from metallic parts prior to MRI. Medication patches and skin patches that have metallic components may be hidden under clothing. These can heat and cause radiofrequency burns during scanning and must also be removed before entering the scanner room. Another safety risk in MRI is associated with MRI contrast agents. Gadolinium, commonly referred as GAD or GADO, is a paramagnetic contrast agent that's used to improve the visualization of anatomy or to highlight pathological lesions or disease processes. It's administered intravenously where the dose is based on a patient's body weight. Gadolinium is contraindicated in pregnant patients, patients with poor renal function, and those who have had a prior allergic reaction to gadolinium. MRI contrast is generally considered safe, but as with any injection, complications are possible. The incidence of anaphylactic reaction is very low, but it can happen. Gadolinium is normally excreted from the body via the kidneys, but there is concern that gadolinium is not excreted normally in some patients, leading to retention of gadolinium in the body, particularly in bone and brain tissue. If a patient's renal function is impaired, there's also a risk of developing serious complications. Renal function should always be checked prior to MRI, and careful consideration should always be made prior to administering a contrast agent.
Thanks, John. Now we'll move on to how we ensure safe practice in MRI. There are a number of key steps we can all do to promote safety in MRI. We will now look at these individually, starting with annual MRI safety training for all staff working in or around the MRI environment. MRI safety education is vital for promoting a safe MRI environment. As a minimum, there should be at least 2 levels of MRI safety training undertaken annually. Level 1, which is basic MRI safety training for any staff that need to work in or around the MRI suite. And Level 2, which is advanced training developed for MRI staff responsible for ensuring MRI safety. Staff that need Level 2 training will include MRI operators, clinicians, scientists, and other personnel involved in making decisions regarding policies, procedures, and practices. Another important step for promoting safety in MRI is restricting access to the MRI scanner room by establishing appropriate supervision of all persons in the control room and MRI scanner room, zones 3 and 4 of the MRI suite. In your department, it is important to know which areas have limited access and which are restricted access, because all persons entering zones 3, the control room, and 4, the MRI scanner room of the MRI suite, should be appropriately supervised. These restrictions are in place to stop an unscreened individual entering the scanner room and to prevent potential accidents. To ensure safety in the MRI environment, access to the MRI control room, Zone 3, or the MRI scanner room, Zone 4, should be restricted at all times. Also, all persons should be appropriately supervised in the restricted zones. In addition, excellent communication between staff members should be promoted. And all staff must be vigilant about ensuring the safety of themselves and others. Next, we'll discuss MRI screening procedures. The third key step for promoting safety in MRI is appropriate screening of persons before they enter the control room and MRI scanner room. MRI screening procedures are important in protecting individuals from MRI system-related accidents and injuries. The majority of MRI-related incidents have been due to failings in the screening process and/or the lack of properly controlling access to the MRI scanner. MRI screening requires an understanding of the risks associated with the various implants, devices, and accessories. It is important that MRI staff always seek the most up-to-date information and documentation about any implants, devices, and accessories. The procedure for screening patients for MRI involves a number of steps. Initially, the patient is screened before the scan date, or scan time in the case of emergencies, to identify any medical procedures or accidents involving metal that they might have had. Then, all information regarding implants or devices needs to be reviewed and approved. Any conditions for safe MRI scanning need to be confirmed and documented. When the patient arrives on the day of the scan, an MRI technologist or radiographer will reassess all safety screening documents. This includes both visual and verbal checks of the patient. Finally, all patients should be changed into appropriate hospital clothes, free of metallic parts, and all metallic items removed. MRI safety screening forms, such as this one pictured here, are used for screening individuals. These forms contain information about a patient's health and a checklist of devices, implants, or surgeries to help establish if an individual has had a medical procedure that may involve an implant or device, and/or an accident involving metal. From a medico-legal perspective, it is always important to maintain up-to-date, detailed patient records. Any implants should be documented along with relevant MRI safety information. An electronic database, or forms such as this one on the right, should be completed and filed together with patient information. The MRI screening form also contains a section designed to assess risk for patients requiring MRI contrast agents. This section includes questions about kidney function and helps establish any risk of reaction to the contrast agent. The MRI screening form also includes space for the patient's date of birth, height, and weight, which are mandatory for safe scanner operation. Remember to adequately prepare patients for their scan. They must be MRI safety screened. Changed out of street clothes into appropriate hospital or clinic clothes free of metallic parts, and the MRI procedure explained to them in a manner that they understand. Any individual entering the MRI environment must be screened prior to access being provided. This includes MRI staff such as radiographers, technologists, nurses, radiologists, as well as researchers, physicians, cleaners, relatives, security officers, maintenance workers, firefighters, visitors, etc. There are no exceptions. The MRI screening procedure for staff is essentially the same as for patients. We need to identify, review, confirm, and document all information about implants, devices, or any accidents involving metal. As with patients, this information must be re-reviewed on the day. We also need to ensure that metal items are removed before entering the scanner room and that all personnel are appropriately supervised. The fourth key step in promoting safety in MRI is establishing MRI safety of implants and devices. There are 3 MRI safety categories in MRI safety labeling: MR Safe, MR Conditional, and MR Unsafe. MR Safe items pose no known hazards in all MRI environments, whereas MR Conditional items have specific conditions that must be met for safe use in MRI. For example, MR conditions for an implant, device, or object might stipulate a maximum static magnetic field strength and/or maximum spatial gradient of the fringe field. MR unsafe items should never be taken into the MRI scanner room. They are not safe in any MRI environment. These are examples of the standard MRI safety symbols used in labeling devices, implants, and equipment. The green MR safe symbol, the yellow MR conditional symbol, and the red MR unsafe symbol are shown. To the right of each symbol are examples of objects appropriate to each safety category. The MR safe plastic medical equipment contains no metallic parts whatsoever and is safe for all MRI environments. The MR conditional permanent pacemaker is safe for MRI only in specific MRI environments detailed by the product manufacturer. The handgun and the scalpel are not safe for MRI and should not be taken into any MRI environment. MR conditional information for implants and devices can be found in the manufacturer product information sheet or instructions for use. Review the MR conditions for safe use and follow the directions to the letter. Be aware that there may be field strength restrictions and scanning limitations. It is important to note that even if an implant or device is labelled MR conditional, it may still cause artifacts on the images. MR conditional equipment used in the scanner room may need to be placed on the patient or used in the room to facilitate MRI examinations. MR dedicated equipment approved for conditional use in the bore includes items such as pulse or cardiac monitoring leads, and MRI equipment such as coils or functional MRI response pads. Examples of equipment that must be deemed safe before use in any scanner room include items such as wheelchairs, stretchers, ventilators, IV pumps, power injectors, and other accessory items, to name just a few. The fifth key step to promoting safety in MRI is performing risk assessments for equipment and ensuring appropriate use. Any equipment to be used in the MRI scanner room must be MR safe or MR conditional, and all equipment must be appropriately assessed and labelled prior to use in the scanner room. MR conditions must always be followed. MRI safety information for equipment is detailed by the equipment manufacturer. Check the MR conditions and follow them to the letter. You may need to secure equipment in the MRI scanner room, and there may be field strength restrictions. Any changes or updates to the equipment must be accounted for and MRI staff consulted. It is important to note that some modifications can render equipment unsafe for MRI. This is an example of MRI equipment labelling. Note that for this piece of equipment, the MR conditions stipulate it is safe for MRI in environments with a static magnetic field of 3 Tesla or less, and at positions in the spatial gradient of the static magnetic field of 375 Gauss per centimetres or less. This means that while this piece of equipment is safe to be in a 3 Tesla MRI environment, it may not be safe in all locations within the MRI scanner room, as the spatial gradients increase closer to the bore of the scanner. Remember, do not bring anything into the scanner room or move any machine until you know the conditions for safe use in MRI. What could we do if there is no manufacturer information available? How can we determine if equipment is ferromagnetic? Ferrous metal detectors or test magnets can help. Such detectors should only be used within the product guidelines because they have varying sensitivities. Think of when you go through the metal detectors at the airport. Sometimes they alarm and sometimes they don't. Remember that a test magnet is never the same strength of the static magnetic field. It is usually a lot lower. There are also important things you need to be aware of in regards to the equipment used in MRI to ensure patient safety. MRI staff must protect patients in the MRI scanner by preventing radiofrequency burns induced by loops in cables or leads. Loops in cables or leads must not be allowed to form within the magnet bore. All cables and leads should exit the magnet bore directly out from the patient without forming loops or touching the patient. Here is an example of incorrect placement of an ECG or EKG cable. Note how a loop is formed inside the scanner around the patient, and see how it touches the magnet bore wall. Do not allow loops like this to form inside the MRI scanner. In this next image, you can see correct placement of the ECG or EKG cable. Cables and leads should exit the magnet bore directly out from the patient without forming loops and without touching the patient or magnet bore wall. Note also the pads placed between the cable and patient to prevent direct contact. Insulation pads are used to help prevent radiofrequency burns to patients in MRI. Sponge pads separate and insulate patients from direct contact with leads, coils, or the scanner bore. The minimum thickness of insulating material should be 0.39 inches, which is equivalent to 1 centimetre, so that there is at least a 1/4 inch gap between the patient and the bore of the MRI scanner. Insulation pads should also be placed between the arms and legs of patients to prevent skin-to-skin contact points forming potential circuits for conducting heat energy from touching body parts. Here is a real-life example of the correct placement of leads exiting the scanner for a patient in MRI. Note the pads placed between the patient's arms preventing the patient's skin directly contacting the walls of the scanner bore, and the large insulation pad preventing the cable touching the patient's legs.
Thank you, Claire, for discussing ensuring safe practices and MRI screening procedures. Up next, we'll discuss emergency procedures in MRI. The final key step to promote MRI safety that we will discuss is to ensure that you have established protocols for MRI emergencies. Medical emergencies can occur in MRI. Ideally, a medical emergency response should never be conducted in the MRI scanner room. It's human nature to rush in to help, and people may inadvertently bring in medical items which are projectile hazards within the static magnetic field. For example, a stethoscope, scissors, a crash trolley, defibrillator, or oxygen cylinder. You may remember this is what happened in the fatal case involving the young boy that we discussed earlier in this presentation. If possible, immediately remove the patient or affected person from the MRI scanner room, also known as Zone 4, to a designated area where it's safe to proceed and provide emergency medical care. A superconducting magnet is always on, but an emergency situation may arise where the static magnetic field of the scanner needs to be turned off. This is referred to as a quench. Quenching the magnet causes a rapid release of helium gas that results in a sudden loss of the static magnetic field. A quench can happen accidentally, for example, due to prolonged power failure or because of an increase in environmental temperature. It can also happen deliberately in an emergency situation by activating the quench button. During a quench, the liquid helium rapidly boils off and becomes a gas. Helium gas vents outside of the building via the quench pipe, which is usually at the top of the scanner. You should be aware, however, that if the quench pipe fails, there may be a buildup of gas and pressure in the MRI scan room. Risks of a faulty quench pipe during a quench include asphyxiation due to a decrease in the available oxygen in the room, frostbite due to the extremely cold temperatures of the helium, Another important consideration is the damage to the MRI system and associated costs of repair, as it can often take some weeks or even months to repair an MRI system after a quench. In the event of a quench, it's important to do the following. Open the scanner door, evacuate the MRI scanner room safely and as quickly as possible. Do not close the scanner room door until the MRI scanner room has been fully evacuated. It's important to note that when the magnet is quenched, the MRI system is not disconnected from the power supply, so there is still a risk of electrical hazard. Also, quenching the magnet is not like turning off a light switch. It may take minutes before the static magnetic field has dropped to safe levels. Be aware that objects held by the magnetic field may fall forwards towards the floor once the field has dropped. To avoid injury, do not let anyone stand under or close to such objects. To conclude this presentation, we will now summarize MRI safety issues that all staff should be familiar with. To promote safety in the MRI environment, all staff need to understand the following. 1. The key aspects of the MRI system and the MRI environment. 2. The very real MRI safety issues and risks. 3. Staff also need to understand the importance of MRI screening and how to undertake the MRI screening process. Finally, all personnel need to be aware of and adhere to policies and procedures that provide guidelines for emergency situations that can potentially arise in the MRI environment. To recap the key steps to promoting safety in MRI. 1. Annual MRI safety training for all staff accessing MRI. 2. Restricting access and establishing appropriate supervision for the MRI control room, Zone 3, and MRI exam room, Zone 4. 3. Appropriate safety screening of all persons prior to entering the MRI control room, Zone 3, and the MRI exam room, Zone 4. 4. Establishing MRI safety of implants and devices. 5. Assessing MRI risk for equipment, including labeling and operating it appropriately. And 6. Establishing protocols for MRI emergencies and following them accordingly. Here's a list of useful resources that we have used to develop this presentation. Please remember to update your policies and procedures in accordance with these guidelines.
Thank you for participating in this Level 1 MRI safety training. If you require additional information, please visit our webpage or the SMRT educational website. Please visit often as we are constantly producing more material and updating information.